So we're just, again, talking about natural. And so a buddy of mine who was instrumental in helping me to get started in the radio world, Tom Skinner, he sent me a text message this morning. And it was kind of interesting. He said, hey, this is, he's retired now, but he sent me a message and he said, straight off the press on USA Today, there is now this big article, and I want to make sure I get it right. I'm reading off my notes here. Breaking news seen on USA Today. It was the undetectable era of plastic surgery is the new beauty revolution. So the undetectable era of plastic surgery is new beauty direction. And I'm going to look at that topic. I'm going to say, well, that's great because I agree with the trend, but I'm going to say, this is old news, Tom, because we've been doing this for years, okay? And we've been trying to guide patients to have a more natural enhancement. So let's just talk about the face. I think what we're seeing is that people don't want to look like they've had something done. So when we talk about surgery, faceless, browless, eyelid surgery, they want a more natural look. But I'd like to focus for the rest of this show, not so much on surgery, but on the non-invasive or minimally invasive procedures that we do for facial rejuvenation to look our best. So I'm going to go now and I'm going to talk a little bit philosophically here, where I said, hey, you haters, step aside, leave these people alone. I'm going to say that part of getting a natural look is that when you look in the mirror, you can't be a hater too, all right? You got to love yourself as well. And the patients that I love to take care of are those who feel good about themselves, but hey, who doesn't want to look better, right? We all want to look better if we're really truthful. So those are great patients. The patients who say, I see a little bit of jowls here, or I see this line when I turn my head this way, or this way I see this. Boy, you're being hard on yourself, and I can't tell you how much cheerleading I do when we do consultations, and how I'm actually trying to get the patient to maybe be a little less aggressive in terms of the treatments they do if they want natural looking enhancement. And so again, I'm really happy now that it's kind of hitting the newsways about sort of the undetectable beauty, if you will, because I love that idea. So what does that mean? Okay, so what that means is have a little bit of movement in your face. One of the revolutionary treatments for cosmetic non-surgical treatments have been Botox and Dysport, which helps to relax our muscles. So it relaxes our frown, relaxes the smile lines in our eyes. But let's not get to the point where we have no movement at all, okay, because that's sort of an unnatural look. But there are a lot of patients who want that. And do we treat patients like that because that's their desire? We absolutely do. And again, we can't be the haters. If someone doesn't want movement, then we should try to help them with that, right? They're not hurting anyone and we're not hurting anyone either. So if that's what they want, that's what we try to do. But if you want to be able to interact with people, to have a natural look, listen to your provider, listen to your injector, okay? A little bit of movement's okay. And I always laugh, and I'm just kind of turning to Jeff, who's a young guy who wouldn't even be thinking of this stuff at this point in time in his life, but I'll get patients and they'll say, I'm worried about Botox because, I don't want to look paralyzed. And I say, okay, Mrs. Jones, that's fine. We can, we'll treat you with a standard dose today, but we can modify and let's see how you react to that. And Ms. Jones comes back in and her first comment is, I see a little bit movement in my forehead. I think I need more. And I kind of snicker to myself because we've just gone from saying we want a natural look and then all of a sudden we want to erase all the wrinkles. So kind of be kind to yourself, okay? A little bit of wrinkles, okay? A little bit of movement's okay. It's going to give you a more natural look, and that's what most people like. That's the undetectable beauty. The other is with fillers. And as we look at fillers and so forth, fillers add volume. So yes, putting a little bit in our cheeks can help to lift up our face, make us look more youthful. How does it do that? Well, it does that by making us look healthier. So even in a young guy like our Jeff, our producer, young guy, and he wouldn't be coming to see me anyways, but if he said, hey, what can I do? And I don't even know how old he is, but a lot of times just a little bit of volume in the cheeks kind of makes you look a little bit more youthful, like when we were younger. We don't, when we look at pictures of us when we were younger, oh, look how young we look. But really what we should be saying is, look how healthy we look. And having a little bit of volume in the face actually is a sign of health. As we get older, our facial volume tends to decrease a little bit, so we need to add a little bit of filler to that area. So that's, again, where you want to listen to your provider and let them help to guide you to get a natural look. And in my opinion, take your time. We don't have to fix everything at once. Just a little bit of filler maybe in the cheeks in different areas, a little bit of filler in the lips can enhance you, make you look healthier, therefore make you look more youthful, and really can give you a great look. So if you want that undetectable beauty, start a little bit earlier, do a little bit at a time, and listen to your provider. And it's a team. You're part of the team, okay? Just on a softball team, you're part of this team, okay? And we want to work with you to get the best results that you can get.